Hey everyone, this is Marwa. Today we'll be seeing about the disorders of the eye. Let us begin with eye glaucoma. Glaucoma is a condition which causes an abnormal increase in pressure within the eye. The front part of the eye between cornea and lens can be divided into two chambers. The chamber between iris and cornea is called the anterior chamber. It is filled with a colorless clear liquid called aqueous humor. In a healthy eye, the fluid aqueous humor is produced in the front and flows through a drainage called the trabecular meshwork. The trabecular meshwork is located in an area called the drainage angle. If fluid doesn't flow out of the drainage angle properly, it increases the pressure in the eye and damages the optic nerve. Moving on to the types of glaucoma. Open angle glaucoma. The angle between the iris and the cornea is normal, but the drainage filters get clogged from inside. In this type, the patient loses his vision slowly without his knowledge. As the loss of vision takes place silently without symptoms, it is called silent thief of sight. First, the peripheral field of vision is lost. In course of time, the central vision is also impaired. Angle closure glaucoma or closed angle glaucoma occurs when the fluid is suddenly blocked and cannot flow out of the eye. This causes a quick, severe rise in eye pressure. Congenital glaucoma. Congenital glaucoma occurs in babies. It often runs in families and is present at birth. It is caused when the eye does not develop normally. Moving on to eye cataract. Eye cataract is defined as the opacity of lens due to clouding. The lens is clear and lies behind the iris and the pupil. It works much like a camera lens, focusing light or an image on the retina. The retina is the light-sensitive tissue at the back of the eye. Once the light or image reaches the retina, it is changed into nerve signals that are sent to the brain. Besides focusing light on the retina, the lens also adjusts the eye's focus, letting us see things clearly both up close and far away. The lens must be clear for the retina to receive a sharp image. The lens is made of mostly water and protein. The protein is arranged in a precise way that allows light to pass through it without distortion. But as we age, the proteins in the lens clump together, causing a cataract. At first, the protein may clump together and cloud a small area of the lens. Over time, the clouds may increase in size and number, clouding more of the lens. If the lens is cloudy from a cataract, the image you see will be blurred and the colors may appear faded. Types of cataract. Cortical cataract. It is also called soft cataract, in which few areas of opaque lens is present. Nuclear cataract. The opacity starts at the nucleus and gets intensified while cortex remains clear. In the later stages, opacity extends to the cortex also. Posterior subcapsular cataract. Opacity formed in front of the posterior capsule at the center in the back and progresses towards the periphery. Vision is much affected during daytime or in bright light. Symptoms of cataract. Cataracts can make images appear dull or yellow. Blurry or dim vision is a symptom of cataracts. Cataracts can cause distortion or ghost images. We have reached our final topic, which is color blindness. Color blindness is a reduced ability to distinguish between certain colors. This condition is often inherited. Other causes may include certain eye diseases and medication. Light perception happens in a paper-thin layer of cells called the retina that covers the back of our eyeball. In the retina, there are two different types of light-detecting cells: rods and cones. The rods are used for seeing in low light conditions, and there is only one kind of those. The cones, however, are a different story. There are three kinds of cone cells that roughly correspond to the colors red, green, and blue. When you see a color, each cone sends its own distinct signal to your brain. For example, suppose that yellow light, that is a real yellow light with a yellow frequency, is shining on your eye. You don't have a cone that is specifically for yellow, but yellow is kind of close to green and also kind of close to red. So, both the red and green cones get activated, and each sends a signal to your brain saying so. So, damage in any of the cone cells is what causes color blindness. Types of color blindness. Monochromacy. This syndrome occurs when 2 or 3 cone pigments are absent or damaged. In this type of color blindness, both the color and the lightness of vision is reduced to one dimension. This results in total color blindness. Dichromacy. This syndrome occurs when only one of the cone pigments is absent or damaged. In this type of color blindness, the color vision is reduced to two dimensions. This results in partial color blindness. Now for the fun part. We'll play a game and find out if you are colorblind.